right. Hello, everybody. Welcome to our Echo today. Thank you for joining us. Um, we're going to go ahead and get started. Thanks for being here on time. We may have some more joining. But anyway, welcome to the Disability and Healthy Relationships Echo. I don't know how many of you have joined us in the past. We did have a similar series last year. But this is the first one for this year. So we're grateful to have you all here with us. Um, we are recording, let's see, let me go over here. We are recording this session. We'll have it saved to our website. But just so you're aware, it is being recorded. So if you stick around, you'll be included on the recording. And for those of you who may be new to an Echo session, Echo is an interactive community. I've got a picture here of the hub and spoke model of Echo. So we have lots of participants in this type of education. So we hope that everyone feels comfortable participating when it comes time for everyone to participate, because we all want to learn together and learn from each other. Participants are expected to be engaged in asking questions after the didactic that we'll be having to provide feedback. And then we'll also have some community questions at the end, like after the presentation today, where we'll all have a chance to discuss as well. As you are sharing, if you do share about other people, we just ask that you make sure and protect their privacy. So here's some examples. Avoid using real names, especially if you're talking about like clients or patients or whatever that you're working with. And if you're not sure how to do that, be sure and you can ask us, but just protect other people's privacy. So we will have that all of us here together is our community of practice where we want us to share knowledge. And then we will have a didactic speaker today. And then in place of having a case presentation, we'll be having some community questions where we'll all just get together and discuss some things. And let's see, this next slide tells us. We would love it if you can make sure your profile name in Zoom has your name. If you feel comfortable, include your state and your job title and organization, or if you want to just put those things in the chat for us so that we can have an idea of who is joining us today. That'd be great. Also, as the presentation is going, if you have a comment or question, you can raise your hand. And I'll either reach out to you in the chat, or if it's like a moment that we can have you participate, just like with you can turn on your mic, we'll do that. We also will be saving all of these to a Canvas course, and if you would like access to the Canvas course, reach out to me. My email is there, mindy.docus@usu.edu. In the future, if you're interested, we would love to have any and all of you who are on the call with us today share a case study. So if you have like a real life example of something maybe you've experienced in your work or something that you are currently facing that you would like to share and kind of have a discussion about that with the other professionals on the call with us, we would love for that. So please, if you're interested, reach out to me and we will get that squared away with you. And today's topic, we're talking about disability and abuse. Our presenter today is Alex Schiwal. Alex holds a Ph.D. from the Human Development and Family Studies Department at USU with an emphasis in adult development and aging. She earned her bachelor's in psychology and gerontology from the University of Montana. She studies geographic distribution of resources for various populations, particularly aging populations, and the associated barriers and outcomes of access to resources in rural areas. She's interested in work related to disability, health disparities, mental health, and end of life. And her role at the IDRPP includes research, evaluation, and grant writing support. She currently works on several ongoing projects, including several contracts with state partners relating to disability and health, the Agribility of Utah, Western Regional Agricultural Stress Assistance Program, and serves as managing editor of the Developmental Disabilities Network Journal. And she's a lifelong resident of Montana and Utah, traveling back and forth to enjoy recreation and visit family and friends. And we're hoping that the weather up in Montana will cooperate with us today, because it sounds like it's kind of windy, and hopefully she'll stick with us the whole time. But anyway, thank you for your participation in the Echo today. I'm going to stop sharing my screen and I'll turn it over to you, Alex.
Yes, thank you so much for that intro, Mindy, and thank you everyone for being here today. Like Mindy said, we have a very nasty windstorm up here in Montana that might knock my power out, and I'm hoping it doesn't during this meeting while I'm presenting. And I am also on day 6 of the flu, so just please grant me a little bit of patience as I try not to die on this Zoom call. Um,
Don't die.
Oh, thank you, Allie and Mindy. So I'm going to go ahead and share my screen. And from the beginning seems like a good place. So since this is the first in our new Echo series for the year, we're kind of doing an overview again about statistics around disability and abuse. So this does come with a content warning. We are going to be talking about abuse and assault, but we're not going to get into too many details. Um, so let's go. And if you have any questions, feel free to put them in the chat or raise your hand, and Mindy can sort of help me keep track of that. Feel free to interrupt if you have a question, and then we will also have time for questions at the end. Okay, so abuse and disability. We're gonna first talk about, like, I'm sure as all of you know, there are many types of abuse that can be physical, emotional, sexual, financial, and there's also neglect and exploitation. And oftentimes it's not going to just be one of these happening, but multiple types of these. So someone may be physically and emotionally abused while they are also being financially exploited. And so it's always unwanted, harmful, and causes someone to be afraid. It's not something they're asking for. It's not something that they're causing. And oftentimes, especially in cases with disability, it is something where people are using their disability to manipulate them in some way. So that can be a little murky at times. So when we talk about types of disabilities, there are many types, and people often have more than one. You can also acquire a disability at any point in your life through accident, illness, or injury, or just the normal aging process, or you can be born with a disability. So we have intellectual or developmental disabilities, physical disabilities, which require the use of adaptive equipment like wheelchairs, sensory disabilities like vision or hearing loss, traumatic brain injuries, which can impact like memory, decision making, things like that, and then chronic illnesses, which is such a broad category with so many different impacts. So we're not going to be able to get into all of these, but just thinking pretty deeply about the ways that all of these overlap and can impact a person is pretty important to understand. And so they also impact someone's risk profile. So now we're going to talk about why disability is a target for abusers. First off, people with disabilities are less likely to report abuse in the first place. And if they do, they are less likely to be believed. And we can have some discussion around this later in the session. And then just by virtue of having a disability, particularly one that limits your activities of daily living more, you are going to be more reliant on caregivers in isolated settings like group homes, day centers, skilled nursing facilities, where isolation is normalized and you are dependent on those care providers, even if they are harmful to you. And so that is something to take into consideration. Um, Another huge thing that we have talked about a lot in our last year of this ECHO series, and that we'll continue to talk about, is that many people with disabilities, just due to social stigma and ideas around people with disability, is that they are left out of education on sexuality, consent, healthy relationships. And that does them a huge disservice because, number one, they don't know how to talk about what's happening with their bodies or communicate about something that is happening to them. They may not understand the concept of consent, appropriate or inappropriate behaviors. And when they're left out of that education, um, they can be tricked or manipulated into thinking that something that is actually abusive is okay. And then there's also a lot of social stigma and belief that people with disabilities are less capable, easier to exploit, and unaware. And this is something that is on the part of the abusers, and they are just exploiting the power they have over people. If they're obviously trying to steal their benefits and want to say really horrible, emotionally abusive things to a person, that is a problem with the abuser who is using their power over someone else. So now we're going to get into specific numbers, and these are pretty widely repeated numbers, and you're going to see some variation just depending on how the data is collected, when it was collected, how they define things. So just keep that in mind as we go through these. But I thought this was a really good graphic that really gives you an idea of how widespread of an issue abuse is within the disability community. So 1 in 4 adults across the United States have some sort of disability. And remember, that can be any type of disability, whether physical, intellectual, or like a hearing or vision loss. And so that comes from the CDC. And then 3 in 4 people with disabilities experience some form of abuse in their lifetime. And that is one of the lower numbers that I've seen in terms of estimates, and that's from the National Center Against Domestic Violence. Um, so these are all statistics coming from the Bureau of Justice Statistics. On their report on people with disabilities. So people with disabilities are almost 4 times as likely to be the victims of violent crimes as those without disabilities. Uh, in terms of those categories of disabilities that we talked about a few slides ago, cognitive disabilities put people at much higher risk of victimization, and we can probably think about why that might be. If we look at the American Community Survey definition and difficulty concentrating, remembering, making decisions, doing due to a mental, physical, or emotional condition, it is likely that they have been left out of that education, and it's maybe easier for someone with negative intentions to manipulate them or lie to them about something that is not okay. And then the reporting rate for sexual assault was nearly 50% less for people with disabilities compared to those without disabilities. And so this is where we're going to get into those numbers varying because it's really probably difficult to collect numbers on things that are not reported. And then individuals with disabilities are significantly more likely to be abused by a relative or caregiver. And I think as professionals, that's something to keep in mind when we're working with this population, is to pay attention to those dynamics between the individual with disabilities and whatever caregiver or guardian is coming into appointments with them. Not that we should be suspicious of every person, but based on the stats, that's just something to know. And so I've put all of the links to sources in here, and these will be sent out after the ECHO session. So some more numbers. In this one from the YWCA, 97 to 99% of cases of individuals with disabilities were abused by someone they knew, whether that was an intimate partner, a family member, a caregiver, or a health aide. So again, this is why it's really important for people to pay attention to those dynamics and how people with disabilities interact and talk about how those people make them feel and what is happening and why education is important. Um, and then, as we talked about, with the number of cases not being reported, most of them are not. Uh, Very upsettingly, of those that actually are reported, only 5% are prosecuted compared to 70% in non-disabled populations. So that just brings up a lot more of that stigma and societal perceptions of people with disabilities not being reliable, not being believed with that prosecution rate, which is really concerning and another area where professionals can step in and sort of support people with disabilities in terms of making reports and helping them through that process. Another thing that we've talked about in this echo and that we actually found some data on was that domestic violence and crisis shelters are often not accessible. One survey from several years ago found that only 35% of shelters have a disability awareness training for their staff, and only 16% of crisis shelters have a dedicated staff person to deliver services to those with disabilities. Um, and there's a lack of training overall for professionals. And so the Americans with Disabilities Act was passed in 1990. That's over 35 years ago. So the fact that a lot of these places that should be safe for people are not accessible is a huge concern. And I know that shelters and other places are doing their best with limited funding, but there's not a reason that we can't all try to do better. So I'm going to take a drink of water again so I don't die on Zoom. And for those of you joining late, I have the flu. So thank you all for being here. We're going to talk about the needs assessment that we did at the start of this project. So we conducted a needs assessment in the state of Utah in 2022 and 2023. We had about 8 adults with disabilities, 44 family members or legal guardians, and 47 professionals complete the survey. And so the numbers and percentages will vary as people skipped questions throughout the survey. We were really trying to understand what information they had received on these topics around disabilities and healthy relationships, consent, abuse, and then what information they needed and where they could get it. And so across all of these groups, professionals had received the most information, and family members and guardians and adults with disabilities had received less. This number looks inflated because it was only 7 out of 14 people who had answered that question. And then across all topics, professionals received more information. So this one was specific to abuse and consent. And those numbers were about the same for all of the categories. I think something that was really helpful for us, but also concerning, is less than half of all participants, regardless of their category, knew where to find information and resources about these topics. So that's an area where we as professionals can support people, is making resources and information available widely. And then we asked about barriers to education and information. And so you have to keep in mind that we are based in Utah with some of these. So there was a lot of concerns around morality and feeling uncomfortable discussing these topics, whether professionally or as a family member. And then stigma and attitudes towards people with disabilities. And a lot of times, even in other topics, we just see people with disabilities being treated in a really infantilizing way rather than as adults. And then the last one is lack of understanding of the importance and need for training and resources on these topics, like A lot of professionals probably don't realize how high risk it is for someone to have a disability in terms of their risk for abuse or any other of those negative things that we talked about. So I'm going to pause here and take another drink. Mindy, do we have any questions in the chat?
No questions, but thank you to those who have introduced themselves. If anybody hasn't introduced yourself in the chat, feel free to do that. No questions yet, though.
Okay, thank you. All right, so we talked about all of the really bad numbers and scary, upsetting things, which I will be honest, I had a hard time putting this presentation together, just swimming in all of that. But now we get to talk about what we can actually do in this area to help. So first of all is, as professionals, we can be better at understanding and identifying signs of abuse, neglect, and exploitation in populations with disabilities. Some of those are going to vary from non-disabled populations, and a lot of them are going to be the same. And this one, I'm just going to keep talking about it and keep talking about it and keep talking about it, as education and training for all members of the communities, for professionals, for family members, and for individuals with disabilities. I think that sharing resources and educating people leads to empowerment. And if you find good information, share that. And then I think something that also needs to happen to improve this is a change in agency culture. So planning for and integrating disability into your programs, making sure facilities are accessible, and staff training about disability. And then asking questions, using your professional networks. That's something that came out of our needs assessment, is that a lot of professionals and family members said we want to be able to talk to other people about this and discuss cases that we're dealing with and talk to professionals and experts on these topics. And so that's one of the reasons we started this ECHO, is to have a platform for people to get together and talk about these things. And then understanding your role, responsibilities you have in your role, and then learning what resources are available that you can use in your workplace or share with people. And so I'm going to go over all of these really briefly. And then we have some past ECHO sessions that address some of these. And then in our next year of ECHO sessions that are upcoming, we will have more specifically on these topics. So if I just glance over something, it's because we either have one or we will have one coming up in depth on that topic. So knowing the signs of abuse. So you're going to want to watch for sudden changes in someone's attitude, appearance, or behavior. If they were really happy when they came in 2 weeks ago, and then they come in to your office or wherever, and they just seem very dejected or are hunched over and afraid, that is concerning. So you might want to ask them what's going on. And so these next few that I have sort of highlighted here are the ones that I think we've talked about the most in this ECHO, and that we encounter the most in a lot of the professions that we've had. So comments about potentially concerning interactions, as people that do a lot of community outreach and education with family members or individuals with disabilities themselves. In some cases, we've had people disclose things to us just by making comments and then needed to investigate those further. And so that is a sign. If they make a comment that is concerning, pull them aside and follow up on it. And then if you notice fear or agitation at the mention or in the presence of a particular person, like if there's one direct support professional that every time they're around, you notice this person gets really upset, you might want to look into that more. And then like extremely controlling behavior on the part of a caregiver, partner, or guardian. So those are all things that I think when you're working with people with disabilities, just to keep an eye out for. And then the rest of these are fairly common signs of abuse and neglect. some of these are specific to disability, so missing their medications, having excess symptoms, not having access to their adaptive equipment, like having their wheelchair taken away or broken, not getting their glasses or their hearing aid or their tablet that helps them to communicate. That is something to really be concerned about and ask, like, hey, how come you don't have this today? It's not immediately going to tell you that this person is being neglected or abused, but that is something to investigate. Obviously, there are a lot of physical signs of different types of abuse, and we can have an additional training on that in the future. But bruises, things like that. And then financial exploitation is something we see a lot in uh, disability populations and then with older adults. And then some things that you want to look for are suspicious names on accounts and people's funds and possessions going missing, like maybe they were sold, and not having adequate care when they should have enough money to pay for it, and serious changes to account balances or new people popping up on their accounts or as beneficiaries. So this one is about education and training and how this can help us reduce incidents of abuse in disability populations. So treat them and people with disabilities with respect. Don't infantilize them or deprive them of information. And sometimes that has to be in the form of you advocating with their caregivers or guardians to ensure that adults with disabilities have access to information, because they may want to still keep them in the dark and infantilize them. I need to move this little box with all the faces in it so I can read the rest of my slides. A disability can be acquired by any person at any time in their life. So I think that professionals should be trained to understand how disability may impact people in their field of work. I don't think it's necessarily a niche topic that only certain professionals need to be paying attention to, because it's 1 in 4 people across the entire population, but it's also something that can happen to anybody at any point in time. Share resources with individuals and caregivers about abuse prevention. I think that is really important to do, is even if you're not concerned, just educating them is really powerful. And then attend trainings and share with others in your network. So people may not think they have an interest in disability or work with disability populations, but I guarantee you at some point they have or they will. And so we will have some more of this shared in our discussions and sent out after this training, where we're going to talk through those community questions, and you are free to share that as well. And then I'm going to highlight a couple of trainings. So the Tetons training is an excellent class that has been developed at the Utah Parent Center in partnership with the Utah Developmental Disabilities Council. And we are actually contracted in partnership with the Utah Developmental Disabilities Council to put on this series of ECHO trainings. And so Tetons is a class mapping a road to relationship, sexuality, and self-determination for individuals with disabilities. They started out doing it for adults with disabilities, and now I believe they have that class for younger ages, and they're working on some for professionals as well. And I think it's incredibly important to be able to empower people with disabilities themselves to understand this material and be able to make their own choices. And then if you follow some of the links later in this, we have a lot of other trainings on our resource page, but I've also highlighted this. Planned Parenthood actually has a whole lot of classes related to disability on a number of different topics. So I wanted to link this here. So if you have someone asking you questions and you don't necessarily know where the best place is, I would check here, because they have several free online self-guided courses for individuals, caregivers, and professionals. Okay, and the next one is focusing on disability and sort of that culture shift in our workplaces. So changing your agency culture. Not all of us work at the Institute on Disability like I do, and you may not have a workplace focus on disability, but that doesn't mean you can't advocate for that to be integrated in your workplace as a population that you focus on because it is such a huge portion of every population. And ways that you can do that are to plan for and integrate disability into facilities. So making sure your buildings, your classes, and resources are accessible. So that's ADA compliance and making sure things you are meeting digital accessibility guidelines and that your classes aren't being held in like a rickety walk up of stairs that no one can get to and no one wants to go up. And then for programs, making sure that your content is relevant and considers disabilities. So, for example, we're working on some stuff with local health departments, and diabetes programs are a major thing that overlap with disabilities and are oftentimes considered a disability. So, you can talk about how that impacts people and may be disabling. And then lastly, staff training. I think a lot of workplaces could benefit from training staff on disabilities at a just 101 basic level. Like what sort of accommodations would be helpful? What are the laws around disability? And then profession or topic specific trainings like this one. And then general accessibility trainings for staff, like how to make your documents accessible, how to make sure that your building is accessible. Those things can really help. And then you have a culture that is reducing the stigma around disability. And then you're also increasing the knowledge across your workplace because not only may you be serving people with disabilities in your clients, but you may also have employees who have disabilities or who may acquire them in their work. And then you're just better prepared to support clients with disabilities and they will feel more comfortable and they will feel that you're a more trustworthy facility or therapist professional who can support them. And then this one, we do have a whole training on this and a couple of fact sheets. Know your role. Are you a mandatory reporter? It depends. Everyone's favorite answer, but it does depend on your job and where you live. But a mandatory reporter is someone who is legally required to make a report about suspected abuse. Um, and that's specific to certain populations. In most cases, you're going to be clicking this link that will take you to the website where I've linked where you can find it in your state. You want to look it up for the term vulnerable adults, which is a term I don't love, but that is how they define it in terms of making reports around abuse for people with disabilities who are adults and not children. Um, but in most cases, if you suspect something was reportable, there are no negative consequences for making a report. And those channels will depend, but they often goes through Adult Protective Services. However, I think there's a lot of important things to consider when you are a mandatory reporter, or even if you're not and you have some concerns. I think you should be transparent about what your role is, what you can do to help them, understand the steps in the process so you can tell people what will happen. And then I think really importantly, just no matter who you're working with, is ensure them that they're not at fault, they're not in trouble because they'll be talking to law enforcement and a lot of people who can be overwhelming. And just emphasize that as you go through this process of mandatory reporting. And we have a fact sheet here about just the steps and guidelines around mandatory reporting, and then one here about how to respond to a disclosure with empathy and making sure that you get all the information that you need. And then we also have our previous ECHO sessions from last year about working with adult protective services and safety planning. So I've linked a bunch of resources here. So I've got our past ECHO sessions. our resource page where we've got fact sheets and other external trainings, and then some other disability and DV and crisis shelter and data links here as well. Here is my email, and I can open this up for questions.
Alex, you made it through. I'm so happy you're still alive.
Thank you. I'm doing my best.
Yeah, if anybody has questions, I haven't seen any in the chat yet. I did notice that Alexandria and Grace talked about that they run the Tetons class that you mentioned. So if anybody has questions about that specifically, they are on the call, and also she posted a link to the website that has more information about that. Um, yeah, any questions for Alex? Alexandria is raising her hand.
She's gonna want to answer. Ask a question.
Yes.
Um, in your slide about like signs to look out for in the disability population, you had mentioned controlling caregivers and guardians.
Mm-hmm.
So we see that a lot, right? Did you find any like black and white like lines of when controlling gets kind of over that abuse threshold?
So that is a really difficult one. And when I was reading off that slide, you might have caught me saying like extremely controlling parents or guardians, because I know a lot of times the parents and guardians we may see may come across as controlling, and I don't think that it would meet the threshold for abuse. Um, so, for example, I will just use my own sister who has an intellectual disability and a traumatic brain injury who lives at home with my mom. And she has to be on a really strict routine. Otherwise, she starts to have a lot of behavioral and health issues. And so my mom has to be really strict about that and has to keep her on a very strict diet as well. Um, and so in public, it may seem like, oh, this person's on a really short leash. She's not able to make her own decisions, but those things are in place for her own health and well-being. And at 8:30, if Mariah stays up all night partying, she's going to crash anyway. So I think you'll have to use, I didn't find any resources to answer your question. No, there were no resources because it's so dependent on the individual and so dependent on the type of disability that they have and what you know about them and their caregivers to watch for that. And I think a lot of times we know, like, you will just have a gut feeling when something is off and when something sort of crosses the line from taking care of somebody who may not be able to make their own choices all of the time to controlling somebody. And that's why I provided those examples of like taking away their wheelchair or preventing them from accessing medications and things like that. I hope that answered your question.
Thank you, Alex.
Yep.
Any other questions? You can put in the chat or you can raise your hand or just unmute. We're a small enough group. If you want to just jump in, you're welcome to. I'll also quickly just put a plug in. There is a survey that has been shared in the chat that if you have to jump off before we're done, please take a minute and fill out that survey before you go, just telling us about your experience here today. All right. Well, if we don't have any other questions, normally, if we had a larger group, we would split up into like breakout groups to chat. But since we have a small enough group today, I think we're going to just stay here to chat about some community questions that we have prepared. Oh, I do see one more question from Grace before we jump into that, Alex. She says, I'm curious what you dislike about vulnerable adults as a term and what would be better.
Well, I'm not going to be able to change legislative terms to my own liking, but I think that is a term that like I can add to that infantilizing idea around people with disabilities, and my background is in gerontology as well. And just because someone may be frail or older or have a disability, I wouldn't necessarily consider them like vulnerable adults because I think that gives us like a paternalistic view of them rather than someone who's capable of making their own choices and having self-determination. Um, I don't know what a better term is, maybe just their name, but I'm not, like I said, going to advocate for a whole terminology change within the legislative framework. I think that's fine to use, but I wouldn't just go up to someone and say, hey, you're a vulnerable adult, if that makes sense. But thank you for the question, Grace.
Awesome. Okay. Well, thank you. Thank you everybody for being here. I am going to oh, sorry, there's a couple more. Before we jump in, let's see. McKenna says, do you have any good resources or trainings on educating sexual assault prevention, consent, healthy relationships, etc., for individuals with disabilities?
Yes, I do. And they are linked in the presentation. And one of them that we talked about is the Tetons program. And Allie, correct me if I'm wrong, but you're also developing an online version of the program now?
Yes. So we do Tetons trainings for self-advocates or individuals with disabilities. We have a teen group and an adult group. Um, you can reach out to us. I'll put our email down in here and our website you can check out. We have classes for self-advocates, for caregivers, and for professionals who support them. So, yeah, thank you for the plug, Alex.
Yes. And then I will also put in the chat our resource page on our website for this project. We have a bunch of fact sheets and external trainings that you can check out as well.
Really good question. Maybe I will wait just another minute. I keep getting almost started and then we have more questions. Please keep them coming if anybody has more. I wish I had a little screen to see if anybody is furiously typing a question, but I am gonna move forward now. Keep furiously typing if you are doing so. Okay. And we can always come back. But I'm gonna go ahead and share my screen. We have some questions that we just wanted to pose to the community. As we're doing this, I wanted to invite everyone to, if you feel comfortable, you can turn on your camera so we can chat. We're just going to chat together about these questions. And we really want to hear from everyone on the call if you feel like you have something to share. There's some faces coming on. Hi, guys. Thank you. Let's see. Let me share my screen. Okay. I figured I like to see the things that we're talking about too. So I will just go ahead and share that. So I'm going to just read through the questions, and then we'll just start with number one and work our way through them. But so first, what ideas do you have for more effectively sharing information and education about healthy relationships and abuse prevention for people with disabilities? It's that's the whole reason we're having this echo meeting is we know that it's kind of tricky. It's kind of hard to get that information out to everyone who needs to know about it. Um, what has worked in your area or in your line of work. Feel free to just jump on in. Um, if nobody jumps on in, I'm going to start calling on people. So if you feel so inclined, jump on in, chat with us. Oh, Allie says educating the guardians and caregivers. Yeah, that's a really great first step.
Okay. I'll jump in. Hi, I'm Ashley. I'm with the Savvy office at USU. So we do tons of education around consent and healthy relationships and setting boundaries. I don't have actually extensive experience with educating people with disabilities. But I think it would be really wonderful if an office like ours could partner with like the DRC or partner with kind of some campus groups that specifically work with students with disabilities and kind of like build programming together. I think that would be a great way to interact with our student population. And maybe that's something I can talk with our director about and see if, I mean, it sounds like you guys do a lot of really fantastic education already, and I think have those resources, but that would be a really cool collaboration, I think, to start to build stuff like that out and accent and reach students specifically.
I love that, Ashley. Thank you so much. That's a great idea. I think collaboration with other like in like-minded and also different entities than where you work that you can kind of work together to get that information out. That's a really great idea. Thank you. I saw Crystal posted in the chat. I think we need to educate medical providers and other organizations like WIC, HHS, teachers. Yeah, other people that are working with the people that needs this education, right? That's great. Who else has something to share? Also,
Mindy, this is Janelle. I'll go.
okay, thank you.
And I come at this from a early intervention standpoint of it. And I think that the earlier that you can start talking with caregivers, with families, or the individual um, is the most helpful. I mean, I don't always think about my toddler having being in relationships, but eventually they're going to be. And so knowing that that transition is going to happen.
Thank you so much, Janelle. I think that's important. And actually, I would counter that with like, I'm in a stage that I am parent of toddlers right now. And I think it's so important for them to understand like relationship things early on, thinking of abuse prevention. There are definitely things I've been doing from really, really early on with my kids to make sure that they can protect themselves and understand like what's okay, what's not okay with their bodies as far as, their interactions with other people. But I totally agree, like the earlier the better that we can get this education going. I see Crystal, sorry, I was just reading it to myself. Crystal posted also a focus on preventing abuse by educating on self-care and preventing caregiver burnout. Ooh, that is a good one too. Yeah, that's really important also.
I guess just in general, health literacy, right? We have to have better health literacy around all these areas, including them in caregivers as well as parents and the people that have those different abilities, so we can have them know what's acceptable and not acceptable from a very young age, but also make sure that they're not fearful. Worked at a student health center for many years, and many of our students who get to college and not ever have interacted with a lot of other people outside of their small group. And that was a little disadvantage for many of them.
Yeah, wow, thanks, Tim. That's really true too. Thanks everybody that is sharing. I want to maybe expand on the question, and if you haven't shared yet and you want to share, feel free, but just we had the couple of like follow-ups. What methods have worked for you in your state, specifically for those coming from different states? We would love to hear also like if there are certain barriers that you see in your area of work or in your state that you're coming from. We know that Utah, we feel like we've got some specific barriers with just our population. And I know Alex mentioned like morality is a huge barrier sometimes that we run into with having these conversations and sharing this education. Anybody have other thoughts, maybe from other states that you would be willing to share?
I could just add what we did at our university, just really quick.
Yeah,
Um,
please.
we had so small college, well, 18 to 20,000 students in upstate New York, private school. And we actually began to recruit students for Microsoft, many on different spectrums and having other different abilities. And we found that having case managers that became trusted individuals with those groups was very helpful. So we could keep them moving forward. And also, I mean, the bad thing was parents paid extra to have that service, but it really made it so those students could actually thrive um, in that capacity and went on to work for Microsoft and be very successful. So you never know it's going to work, right? If we can find the right support. We also, as part of the health center, we would go and actually individually speak with the students about what was right, what was wrong, how their health was, and try and become, again, a trusted individual that they could come and see if they needed help for their own personal health or in wellness, mental and physical, was part of the health center, part of the university.
That's amazing. That sounds like a really great way to get the ball rolling and to really set people up for success in a lot of different ways. Yeah, thank you, Tim. Crystal, I see in the chat also said maybe have disability abuse prevention education for families and parents with students who need 504 and IEPs in school. It would maybe catch the kiddos who wouldn't otherwise get the information. That's a great idea too. I love that. Okay, any other thoughts on these questions before we move on? Crystal, yes, please. If you want to unmute and just talk to us, Crystal, go for it.
So the only reason I'm making suggestions instead of offering solutions is because I don't really see a whole lot of people getting this information as we speak. We've had cases where this poor girl had some kind of genetic thing. I'm not sure what it was, but she wasn't able to get birth control in a timely fashion. She ended up being taken advantage of by people who were caring for her. And now she's got a baby that she can barely care for because she can barely walk as it is on her own. And so it's like if we can prevent more cases like that, that should be the priority. And then I think about another time where the girl was in and out of drugs and she was a little delayed intellectually as well. So she has disability, but because she's got Medicare, they wouldn't pay for her to get her tubes tied because they don't cover that service. So it was just like there's these breakdowns for certain individuals in getting the care that they need, and it's just really sad. And so I see the sad stuff, and so I'm hoping to hear more information on how it works because there should be more. Like I'm getting this information because if it happens again and I see someone in this situation, what can I do to make sure that I'm properly educating them? Because their needs are different from someone who is 100% able to advocate for themselves and, be able to look it up and find the information easily. Not everyone has that at their fingertips. So
Thank you so much, Crystal, for sharing that. And I agree, those cases are really sad and challenging to deal with, especially when they're running into these systemic barriers at like the state or insurance level. So I appreciate you highlighting that. And hopefully we can come up with some ideas and share resources together that you will find helpful. And
thank you.
yeah, thank you for sharing.
Yeah, I was just going to add, I think that's the idea, right? That's the goal is that we make everyone 100% able to prevent these things from happening or at least stand up for themselves and get whatever it is that they need, whether that's protection or that's um, getting like abusers sent to prison or whatever the thing is, we don't want that to be happening to anyone no matter what. So thank you so much for sharing those things. Any other thoughts before we move to the next question?
Hey y'all, I can share. My name is Nova McGifford. I'm in Pennsylvania. I work at the Pennsylvania University Center for Excellence in Developmental Disabilities, the Institute on Disabilities. I know there's more than one of those in the AUCD network, but I'm in Philly, and I coordinate the Healthy Sexuality Project. And I'm thinking about like what methods have worked and just thinking about how many ways there are to interpret that question, like successful outreach versus actually making sure that people are able to apply what they learn and make a difference. There's just so much more research that we need to understand what is actually working for folks in terms of like making real differences in their lives. So that's one, I'm sure everyone is aware of that, but that really is speaking to me right now. But there's a couple, things like approaches to education that I really feel energized by and seems in my work in Pennsylvania seems to be effective in terms of like getting people to really engage. One of those is really focusing on, like what makes like pleasure and what looking at prevention as a like how sexual self-advocacy, which that term that was developed by Green Mountain Self-Advocates, and really like how do we help people feel more agency over their lives in general, which is like we do a lot on everyday consent, which includes like all aspects of like having control, like figuring out how to communicate better and figuring out what you might need and want. Um, and that starting from that place is super important if we want people to then be able to navigate those harder relationships. So I'm seeing a lot of, yes, we all know this and support this. And it's really hard to change cultures in institutions and in families. And I'm not a parent. I go into parent workshops really, like being like, I'm not a parent. And, these are some things that these are tools and these are things to try. And, just like bringing in that humility as an educator too. Um, but yeah, so thinking about pleasure and just like how important it is in this political moment, and also in, Pennsylvania is a state with a lot of different, in Philly, we're kind of like our own world, and then we have so many small towns that are so culturally different than Philly. And so like really just trying to like tailor our type of messaging, like where the starting point for the workshops. I'm sure people here do that too. It's like we're going to talk about healthy relationships and safety in certain contexts, and then we're also going to make sure that we also offer, virtual spaces for people with IDD and other disabilities who like really want to talk about sex toys and pleasure, or talk about like more nuanced things. And that doesn't presume that there's, like you don't have to have been in a relationship or having sex, like, but that like you're ready for a different kind of conversation, and that there is that variety within, like folks are out there. If you create the space, it is about like building um, relationships with, and that's like really trying to do that in different communities across Pennsylvania with disability advocate organizations who are able to, like then reach a different group of people than we would be able to as an academic nonprofit who's like doing a lot of family support and caregiver, like which all I love working with professionals, like all of that is super important. And it's hard to do it all, but we do try to like vary our approaches. That was long. Thanks, y'all.
That was great. Thanks so much, Nova.
Yeah, thank you so much. We're so happy to have you here.
Yeah. I loved the piece of you said so many important things, but the piece that you said that I think is so important and I think valuable for also our state is to like starting with talking about consent and also understanding just pleasure and making sure that the conversations that we're having about these things are really applicable in like an everyday, not necessarily just in sexuality topics, but also just in general consent, and then how that leads into these other conversations as well, and how important it is to understand that these are also just parts of life, and they're not something that need to be immoral or that the conversations need to be uncomfortable even, but it's just part of life for everyone. Tim, I'm seeing you, and healthy sexual health actions that can prevent disease. That too. Yeah, that's so important. And that also impacts just daily life for all of us, regardless of ability status or disability status, right? So it's just important for all of us to understand. Thank you guys so much. Let's move on to the next question. That was such great information from all of you. Thank you so much for sharing. Next.
And I am going to jump in really quickly. And as part of our echo structure, we have a designated note taker in each of these sessions, and then we email out the notes from these discussions at the end. So I'm taking notes while Mindy is facilitating, so we can write down all of these really excellent comments that everyone is making. So keep it up. Thank you, everyone. And I'm going to go back on mute so you don't hear me coughing. Thank you.
Or you're furious typing also. Okay, our next question. How might someone's type of disability, cognitive, mental health, or physical, among whatever other disabilities might be out there, how may that influence their risk for abuse? I know Alex in her presentation, there was a slide that talked about how people with cognitive disabilities tend to be more likely to experience abuse. But what other maybe experience or ideas do you guys have around that? Also, in connection with that next question, how can professionals use this knowledge to better support education and prevention as we're working with people with various different disabilities? Thanks for joining us, Nova. I see you've got to head out.
I didn't want to interrupt, but I also didn't want to disappear. I gotta go, y'all. Thanks for having me.
Thanks
Thank you so much.
Yeah. Okay. See you later.
Bye. Okay, Jeannie, thanks for jumping in. She says, I believe cognitive mental health disabilities are probably less likely to be prosecuted than the ones with physical. I would love to hear you talk more about that. Or type more about that.
Well, I think the ones with the cognitive or intellectual disabilities aren't believed as much. Those with physical disabilities, I believe that like the police, the DAs believe them more. It's, it's a matter of a belief system. And unfortunately, people discount what those that have disabilities say.
Yeah, totally. I think you're so right, Jeannie. And that's a really hard reality. Sorry, I don't know who was starting to talk. I was just going to say that's a really hard reality to face.
Yeah, I was just going to say I was shocked when I read that statistic about the difference in prosecution rates between people with disabilities and people without, 5% versus 70%. So I think that's a really great point, Jeannie. Thank you. And then looks like Tim put something in the chat, and then Allie was going to say something next.
Allie, go ahead.
I think when it comes to the different types of disability or like different amount of support needs that different communities require, you see a difference in education. So if you grew up with a physical disability, you're more likely to be included in more peer-to-peer conversations, included in sex education courses, included in more direct talks with your family about sexuality versus when we have the IDD population who are just totally excluded from that for so many different reasons. So I think it comes down to education differences.
Yeah, I feel like that goes right along with what Tim posted also. He said our deaf and hard of hearing students had significant abuse concerns. We needed to speak separately to those groups in their language of choice. that's such an important, of course, you've got to be in the language that people are going to understand and feel most comfortable speaking in, and also just education is meeting people where they are, and making sure that the education or the support that you're sharing is actually usable, for those people that you're sharing with. Thank you, guys. Crystal, if people are taught in different styles depending on the learner, the different disabilities would need modification in the education in order to make it personal to the client. Yes. Yeah. And to make it feel applicable to them, right? To for them to understand and also feel like it is they're able to use it. Leo, thanks for joining in. Lack of accessible services or interpreters can lead to isolation and inability to report abuse. Making sure we make resources accessible and allow for clients to have a safe space is critical. Yes, absolutely. Thank you so much for sharing that. Anyone else have thoughts they want to share on that one? I mean, I had a thought just that if we're aware that certain types of disabilities, like cognitive, maybe mental health, are more likely, um, people with those disabilities are more likely to not be believed, and maybe their abuse goes like unbelieved and unreported. That for us is maybe a cue to make sure that we are paying attention to, if we have a client that has a cognitive disability and they tell us something that may or may not mean anything, but it maybe could be kind of a red flag. Maybe that's our cue to make sure that we do our due diligence to make sure that they are heard and that we get the whole story if there is something going on, because potentially maybe they've tried to reach out and haven't been believed, or something to that effect, because that happens so often. So just having that knowledge in our tool belt, I think, is a really important tool. Okay. Any other thoughts on that question? Oh, Leo. Oh, no, we already talked about that one. Okay. Okay, let's move on to the next question. Time is flying, you guys. So our third question, given the fact that most cases of abuse of people with disabilities go unreported and or are not prosecuted, how can professionals support and or empower people with disabilities to feel like they are able to come forward with their stories or make a report? Grace, let me read what you have. Lack of belief coming from lack of trust in their ability to accurately report their experience, or because IDD folks are assumed to be asexual, or because of presumptions of deviance, or all of the above. Yeah. All of these things play into it, don't they? Yeah. So understanding the actual needs of these people, regardless of having a disability, that's so important. And building that trust, that kind of leads into one of the follow-up questions we have on this, being able to build trust with the people we're working with so that they know that we actually are listening and actually will support them with whatever it is they're trying to tell us, or that they need to report or whatever.
I can jump in. This is also, again, coming from like a victim advocate, confidential advocate role, which I know everybody here has a different role. But a big thing for us when we're working with anyone who's experienced violence is making sure that we really intricately understand reporting processes. So understanding what it actually looks like to report to police, what are all the different steps, what happens afterwards, what are the various different outcomes, realistic expectations around that. Same with like Title IX if you're at a university, or whatever the different reporting processes may look like within your institution or whatever it is. So that whenever we explain it to people, we're able to be the person they ask questions to, the person, like we can go with them to go to meetings or go to police or things like that, and continue to be a support person like through the reporting process. And we find that that makes it way easier for people to report and or just understand what reporting even is and looks like. So I would imagine doing all of that, but then also understanding how to explain it to different people and different populations, and yeah, would probably be well, not the easiest by any means, but would definitely be like a helpful step.
Yeah, for sure. Educating yourself so that you can help explain it. It is so complicated. It can be so complicated and tricky. So, understanding that really, really well so that you can not only handle it and follow the steps that you need to do, but to be able to share that with the person you're supporting and let them know it's going to be all right and we're going to figure this out together and this is what's going to happen clearly so that they understand and it's not so scary for them. I love that. Alex, did you have a comment? I noticed you unmute.
Oh, yeah, I was just going to say thank you for mentioning that, Ashley, because that is such a tricky part to try to write in the training because it varies so much from state to state and job to job. So you have to really know what your role is and what the process looks like from where you're sitting at. And then I did want to ask, just as a follow-up, Grace, if you wanted to add any more to what you put in the chat, just because I had put that in my notes and wanted to know if you had any more context to add to that.
Oh, she needs to mute. Me and Allie are together.
Oh,
Hold on. Let me put some sound on. I'm not sure if I have anything to say as extension of what I put in the chat. I think I was just trying to kind of work out where it comes from, that it's really only 5% is prosecuted. Like, what is at the core of that? Because that is so unbelievably low. And so, these are the things I know about this population. And so I'm just trying to work it out. I don't know that I have more to say yet.
yes, and I was really going through and reading stuff as well, trying to figure out like where is that coming from? Where is that breakdown happening? But I think you really pointed out a lot of the things that could be contributing to it. And then we also know, I think about 40 to 60% of people within the criminal justice system also have a disability as well. And so I think there's just a lot that we could dig into there.
Yeah. Thank you. Thank you both. It is staggering. Crystal, I see you have your hand raised. Go ahead.
I think some of it is some of the abuse is probably coming from the people caring for them. And so if it comes down to actually showing up to court and doing a statement and doing all these follow-up visits, it's probably relying on the person who is hurting them to get there. So it's probably easier just to say nothing and keep going along than it is to go through with getting yourself the help that you need. And if you think about it, some of these people have been told from day one that they need this other person, that they cannot do anything on their own. And so they're in this position of relying on this person that's hurting them. So what would be the benefit of them actually turning them in and facing a consequence of completely being on their own and having no support at all versus just dealing with it? And unfortunately, I think that's the situation a lot of the individuals are in or mentally being told their whole lives, that pretty much brainwashed into believing that that's the truth. And then when they finally do say something, half the time they're not believed. So then it further weakens their viewpoint on getting help in the first place. That's just what I've seen so far from other people I've talked to. But those who didn't have any disabilities, who needed to report a rape or something, I would sit with them in the whole process and they'd send nothing but male officers. It's like this is 2025 when this happened, and it's like they didn't send a single female, knowing that this young client was raped by someone that she knew. And, luckily I was there to sit with her until we can get a victim advocate. But in the meantime, they sent nothing but male officers. Now I'm trying to imagine if I had a disability and this had happened, maybe it was a caregiver or something, and then they send someone who looks like them to come and talk to me while they're in the room. It's just weird. This could be better. And I don't know if it's because I'm in a rural area, because I'm really rural. It could just be that. It just could be they don't have the support that they need to feel confident in going ahead and escalating the fact that they need help or that they even need help in the first place because they're being told that this is normal. So how do you tell somebody that this isn't normal when they're in isolation?
Yeah,
I don't
and I
know.
think that's a really important point. And thank you for sharing, Crystal. And first of all, coming from a rural area, a town in Montana of less than 100 people, I get you there. So I think that this is both like a rural issue and then also just a nationwide issue, just due to that lack of training and education across the board. And I think that's really where we can make a difference to like training professionals and training individuals. And I had one other point I was going to make. Um, Also that yes, we do see that is that people either don't report or can't report because they are so isolated and reliant on these people who are their caregivers. But that's where we as professionals can sort of make those inroads with them and build trust and let them know like there are ways that you can get out of this and not be dependent on them. And you do have the agency and other ways that you can live independently or with a different caregiver who's not going to do this. Um, and so there are resources out there, but that is the unfortunate reality of a lot of these cases.
Go ahead, Crystal.
Do you know if there's anything that would, like systemic wise, like if you're on disability or getting Medicare for a disability, that there would be someone who can just come and check on you, like, I don't know, annually or something, just to lay eyes on someone? Because some of these people never see anyone but their caregiver their whole life. They don't, they just get what they need for their disability paperwork, they get, and that's it. And the only interaction they get with other people is their caregivers. And I'm wondering if there's a way around that. Like, I don't know. I'm curious.
Yeah, just one thing they're trying to do, and here it's a little different with community paramedicine. We're trying to have paramedics go and visit people after they've gotten out of hospitals, and that to make sure they're taking their medication. They're trying to alleviate, patients going back into hospitals within a couple of days so they don't get penalized. The hospitals get penalized if that happens. That's where the funding comes from. But maybe looking at something maybe along those lines, if you look in, I don't know if Kentucky has that, but maybe looking at maybe change the policy and have even people, the paramedicine groups go and just, a paramedic would just go and check on patients that, that maybe need some help. Might be something to think about and look at.
Yeah, I think that's a really great program, Tim. I don't think we have anything like that out here in Utah. And then I also know that Adult Protective Services does drop-ins as well. And then the Long-Term Care Ombudsman program, I think, is a really great resource. And typically that's for older adults, but it also falls into that vulnerable adults category, especially for people living in like congregate care settings. And so if there is a concern, those people do check on them regularly, and that is their job, is to make sure that they are receiving quality care and sort of mediating any concerns around that between advocates or family members and the caregivers. And Mindy, I want to say we're almost at time here.
Yeah, we are. You guys, this conversation is so great and it's making time fly. Um, let's go to our last question. We just have a few more minutes. We're scheduled till 1 o'clock Mountain Time, but here's our last question. What other learning resources or trainings about abuse prevention do you use in your work? Feel free if you have like links to things that you've used that you've loved, throw them in the chat, or if you want to just share, you can unmute and you can chat with us. If you have some good things, we've talked about Tetons. I think that's a really good one that we've already shared. But if anybody has any others that you want to bring up and share with the group, we would love that. The very last question too is maybe if you don't have resources that you know of that you've used, but there's something specific that you wish you could use. Like if there's a specific language that you wish that there were resources available in, or certain learning formats or content geared towards specific disabilities. Um, we want to hear all of those things. Okay, so Crystal, you shared a link. Thank you. I don't know what that is for, but it looks like a thing. Thank you. Do you want to tell us
So
about it?
yeah, so the RHNTC, we use it because it does have a lot of education on family planning, which is education on like safe sex and birth control. But they also have like what human trafficking looks like, trauma-informed care,
Wow.
what abuse looks like, how to approach letting someone know you're a mandated reporter, but also having that rapport with them to feel safe with you. And I really feel that these trainings have helped me because I'm a nurse, and so having that trauma-informed approach is really important because some of these clients that come in, they have been through some stuff. And so having that non-judgmental tone, coming in there, meeting them where they are, they just over time feel comfortable and then they tell you the weirdest stuff and it's really educational. So I don't know, I just feel like it was a really good learning platform and I love listening to it as long as reading it. I sometimes can't just read it. And so what's nice about all their trainings is they have where it reads it to you like a narration, and so you could follow along, and then there's a lot of really good pictures and videos and personal stories that go with it.
Thank you so much. That sounds amazing. Let's see. And Grace, you posted some things. Elevatus, is that how we say that? Friendship and dating program and Mad Hatter Wellness are part of the Tetons program that they use. So awesome. That's great. And then Tim, I see the Utah Office of Homeless Services.
Yeah, many of the people that we see, at least in what we do here, in Logan, we have a warming center here, but also across the state, a lot of the people we have do have disabilities that we work with.
That's really great. That's looks like a really great resource too. I just pulled it up and they've got all kinds of information on there. Thank you, Allie. Your sexual health toolkit. I'm just pulling these up as they come in and checking them out. I love it. A resource for education for self-advocates with IDD. Yeah, that looks awesome. This one's very like visual. It's got colors and buttons, and that one looks like a really great resource too. Oh, and it's a game.
One thing we didn't put in here just really quick is our local health centers. Sorry, local health offices like Bear River Health Department. So health department offices are really helpful in all areas to talk to and see what kind of resources they have available that they might recommend and maybe have some experts in their fields there. I know I taught a bunch of people in health departments. I just teach classes on HIV and AIDS. And actually, many of the people that were actually part of those groups would come and take courses from us at the university.
Thank you, Tim.
Yes, I think that's a great point. I think local health departments are often underutilized, but they do have a lot of great classes for communities and professionals. And then also on top of that, extension offices, because those are out in more rural areas.
And I'm part of an extension office, actually, as part of what my role is too.
Oh, well, that's exciting to meet you. Just another face at USU that I don't see out here in Montana.
There's many people all over that are trying to do good things, right?
That's right.
Well, thank you. Nice to meet you also.
Thank you all so much. I'm pulling up these links as they're coming in, and they're all so cool. I'm looking at the Your Sexual Health Toolkit. It's set up like a game, um, that you like make choices about different situations and really great opportunities for conversation, like conversation starters, it looks like. That's really awesome. The Real Talk, free, accessible such sexual health education. That looks really, really great too. So, um, yeah, we are running out of time, but if you have any others, please keep putting them in the chat. Um, I just want to, before we close out, that survey that's floating around in the chat, if you haven't already, go ahead and click that and make sure that you tell us about your experience with us today. Thank you, Janelle. There it is again. And let's see. Sorry, I'm just gonna move some things around on my screen so I can see what we were doing. I am so happy about the conversation that we've had today. This has been so great. Alex, your presentation was amazing. I feel like I have learned so many. Honestly, it was really depressing the first little bit of this meeting because it is really sad. There's a lot of really sad situations out there, but we're here to work together to make those sad situations become fewer and fewer and hopefully educate everyone with what they need and the power that they need to be able to take care of themselves. So thank you so much for being here and for all your comments, for joining in with us. We will be having these meetings once a month moving forward. So now that you've registered and you've been here, you'll be getting emails from us. So we hope to see you again in the future. Thanks so much for your time today. And that's it. Have a great rest of your day.
Thank you, everyone.